Good afternoon. Welcome to the lecture on pharmacotherapy of type 2 diabetes mellitus. In this PPT, I will be explaining the classification of the drugs used in the treatment of type 2 diabetics. We have oral and injectable drugs which are exclusively used only in type 2 diabetes mellitus. That means I will not be able to use them in the treatment of type 1 diabetes mellitus, because in type 1 diabetes mellitus I can use only insulin. Now oral antidiabetics are preferred. Why? Because they need not be injected, and this becomes very convenient, and expenses are also less. Although 50% of all type 2 diabetics who are started on oral antidiabetics will ultimately need insulin. Another important aspect here is the oral antidiabetics. We have two classes which are having the ability to significantly prevent macrovascular complications of diabetes like coronary artery disease and cerebrovascular complications. This is in contrast to insulin, which has the ability to prevent significantly only microvascular complications. So that seems to be an added advantage of only two classes of oral antidiabetic drugs used exclusively for type 2 diabetics. Now we should remember that dietary modification and physical activity are very important interventions in type 2 diabetics, for the simple reason that obesity is an important etiological cause for insulin resistance, which in turn is responsible for type 2 diabetes. So drugs can only supplement these two important interventions, that is dietary modification and physical activity. Now oral antidiabetics are classified based on their action. It could be enhancing the insulin secretion, that is we call such agents as insulin secretagogues. They can overcome insulin resistance. There could be some drugs which retard the glucose absorption, and miscellaneous drugs which do not fit into these three classes. Now the oral antidiabetics which enhance insulin secretion are sulfonylureas, meglitinide or phenylalanine analogs, dipeptidyl peptidase 4 inhibitors or DPP4 inhibitors. So these three classes are insulin secretagogues. The sulfonylureas can be of first generation or second generation. Tolbutamide is first generation sulfonylurea. Glibenclamide, glipizide, glycoside and glimepiride are the second generation sulfonylureas which are insulin secretagogues. Now the second class of insulin secretagogues, repaglinide and nateglinide, are meglitinide or phenylalanine analogs. The third class of insulin secretagogues which can be given orally are the gliptins. They are the DPP4 or dipeptidyl peptidase 4 inhibitors. Sitagliptin, saxagliptin, vildagliptin, alogliptin, linagliptin and teneligliptin. So this is the third class of insulin secretagogues. So under the drugs which enhance insulin secretion, we have sulfonylureas, meglitinide or phenylalanine analogs, and the third class dipeptidyl peptidase 4 inhibitors. Now, there can be oral antidiabetics which can overcome insulin resistance also. These are the biguanides and thiazolidine diones. Metformin and fenformin are the two biguanides. Pioglitazone and rosiglitazone are the two thiazolidine diones. These are the two classes of oral antidiabetics which have the ability to significantly prevent not only microvascular complications but also macrovascular complications of diabetes. This is an advantage over insulin, which can significantly prevent only microvascular complications. Now, to remind you, microvascular complications of diabetes consists of retinopathy, nephropathy and neuropathy. Macrovascular complications of diabetes consists of coronary artery diseases, cerebrovascular diseases and peripheral vascular diseases. Now, this is the third class of oral antidiabetics which are exclusively used in type 2 diabetes, and they act by retarding glucose absorption, acarbose, miglitol and voglibose. The fourth class of oral antidiabetics exclusively used in type 2 diabetics, bromocriptine, which we have already studied as an anti-Parkinsonian drug. It is a dopamine agonist. And we have sodium glucose cotransport 2 inhibitors, dapagliflozin, canagliflozin and empagliflozin. So this completes the four classes of oral antidiabetics which are used exclusively in the treatment of type 2 diabetes. That is the first class, which act by enhancing insulin secretion, the second class which act by overcoming insulin resistance, the third class which act by retarding glucose absorption, the fourth class of the oral antidiabetics which are the miscellaneous agents which do not fit into the earlier three categories. They have a different type of action. Apart from the oral preparations which are available, we have some exclusive drugs which are used as injectables in type 2 diabetes mellitus. These are the glucagon-like peptide 1 receptor agonists, GLP-1 receptor agonists. There are two drugs, exenatide and liraglutide. So this completes the classification of the drugs used in the treatment of type 2 diabetes mellitus. We have oral as well as injectable drugs. The further presentations, I'll be explaining the pharmacology of these drugs.